Well, good morning. It is Tuesday, June 21st, and this is Red Sea Roundup. I am your host du jour, Pam Marvin. And later in the show, we will be visiting with Mary Claire Carden of St. Joseph, and she's brought a few friends. So let's go ahead and introduce ourselves this morning, Mary Claire.
Hi, I'm Mary Claire, and I'm the Director for Spiritual Care for the St. Joseph Health System.
Welcome.
And I brought with me Mike.
I'm Mike Redmond. I'm the Director of Care Coordination for the Clinical Integration Program at St. Joseph's.
And I'm Reed Edmondson, and I'm the administrator of Grimes St. Joseph Health Center and Madison St. Joseph Health Center.
So welcome, Reed, Michael, and Mary Claire. We're going to be discussing today on the show poverty in the Brazos Valley. These are probably the most educated in our region on what is going on. So we are going to really find out what the pulse is of the poverty situation in the Brazos Valley. As we know that Pope Francis has really put that on a lot of our hearts. And these folks, they know the stats, they know what's going on, and we're going to just really talk about that today. So let me remind you that we are a call-in show. If you have questions for these folks later on, please call 85-LOVE-RED-C, 855-683-7332. We would love to entertain your questions or comments you might have on this very important topic today. I want to also welcome in the studio my friend and colleague, Gene Wilhelm. Welcome, Gene.
Hello, Pam.
He is the producer today. He's in the hot seat. Dennis is enjoying the summer months. And we love you, Dennis, and you get some good rest and come back when you're ready. And Gene, while he's very busy over there, he did have a few things that he wanted to talk about this morning.
Well, as a grandfather of 10, I would really like people to think about what's happening to their grandchildren or children that are getting ready to go to school. I have my eldest grandson is going to be going to college this year. I have 3 grandchildren who will be entering high school and 1 that will be beginning kindergarten. Mm-hmm. And I know that every time you make that transition from one thing to another, there are all kinds of challenges. And even when you're in a Catholic school environment or some type of a religious school environment, there are challenges that come up. Just because it's Catholic or belongs to some other denomination doesn't mean that our enemy is not at work trying to disrupt the lives of our children and grandchildren.
Well, I'm so glad that you're mentioning this because my next show on August 18th is about life coaching and getting ready for the new school year and being organized and those things to be concerned with as far as school goes. And I'll be having Miranda Wolochowski on again to talk about it. She's really awesome as far as organization and changing habits. I love that. She's a really expert in trying to form good habits. And
this isn't the kind of habits that a nun or a priest would wear.
No, Gene, not at all.
Okay.
But I want to thank everybody for joining us. I just have a few things that are around our local community that I'll get started with, and then I am very excited and looking forward to our discussion here in just a few minutes, so y'all bear with me. Okay, well, married couples movie night is coming. Come and celebrate marriage Friday, July 24th from 6 to 9 at St. Mary's Catholic Church Center right here. We will be watching and discussing and having a potluck dinner. For more details, RSVP to Carrie Schumann at metaggiecatholic.org. Also coming up at St. Anne's in Somerville with our dear friend, Father Uche. Save the date. The Rural Life Mass is August 20th there. The 26th annual Rural Life Mass will be celebrated at 6 p.m. at St. Anne Parish in Somerville. Bishop Joe Vasquez will celebrate the Mass, which is sponsored by the Austin Diocesan Council of Catholic Women. The Mass recognizes the hard work of our farmers and ranchers and gives thanks for a good harvest. And dinner will be served after the Mass. Just a big shout out to all our farmers in our community. I have a very dear friend, she and her husband are farmers, and this rain has actually kind of wreaked a little havoc on them. So God bless all of them and their work, and what a beautiful thing that their livelihood is tied to our planet, which is also something we have great care and keeping for as well. So God bless all the farmers in our community.
Pam, I have a son-in-law who's a farmer too. So
Do you?
Yes, and it's been a very challenging year for them so far. The early rains wreaked havoc. I know when he was harvesting his wheat, he said that there was so much rain that the wheat actually began to sprout in the head. And they really weren't able to get into the fields to do some of the work they needed earlier.
Right.
And now it's just the opposite problem. There's not enough water.
Right. Well, my friends that are farmers were saying that because of the great amount of rain, the root systems didn't go very low because there was so much available water on the surface. So now that we have drought, it's all dying. So it's like, well, our poor farmer is so tied to our nature.
Well, and with all the water, a lot of the growth was shunted so that the plants didn't get as tall as they should.
Right, exactly. So God bless our farmers and save that date, August the 20th. Well, there's a lot going on always at St. Joseph Catholic School here in our community, but just to mention a couple of things, and I think this is great. The Knights of Columbus is sponsoring a barbecue chicken meal with all the trimmings from 10 to 2 on Sunday the 26th at the St. Joseph PAC. Now, these proceeds are going to go help the varsity football team, which is a big love of mine. My son played for them for 4 years. I love Friday night football. I'm just a terrible addiction. My family gets upset with me that and SEC football. Oh, shame on me. Okay. And the other thing that's going over there is they're going to be having also the big golf tournament, and that's just right around the corner on August 3rd, so that's not too far away, and it's going to be at the Phillips Event Center at Briarcrest, I guess formerly Briarcrest Country Club. Okay, and again, those proceeds go to help the St. Joseph Booster Club. If you'd like more information on that golf tournament, you can call the school at 822-6641 or just log on at stjosephbcs.org. And another thing that's really close and near and dear to my heart is over at St. Joseph, they are going to be having the first annual August 1st, they're having their 17th annual community charity fundraiser garage sale. The proceeds will benefit several community charitable entities, including KEDC. So if y'all need to find out more information, please log on to the St. Joseph Church website to see when you can drop off and deliver goods. And the proceeds, again, will be going to, I believe it's KEDC and 2 other organizations. So get out there and support them on August the 1st. Also, later up in August, if you are thinking about Catholic school, just as we were talking about earlier in the show with Jean, that they are enrolling because they start a little earlier than the public school system. It's August the 17th is their first day. Lots of wonderful folks. They'd be happy to give you a tour and show you around their campuses. They're really revitalizing or actually creating the junior high campus. So if you want to go and check out what's going on at St. Joseph, I'm sure you could call Patty Blazek over at the upper campus or Jim Reich at the elementary school campus. Okay, let's see. That's going to be about it that I want to do for Around the Town that's going on. So I want to go ahead and I'm going to get a little early jump on things today. So, Jean, you start to cue me when you want to go into the I've got about 10 minutes before we'll go into our break, but I want to go ahead and get started because we have such a good show this morning. Now, I have not met Michael before, but I have met Reed. Reed and I worked together years ago. You know how long ago it's been? Would you believe me if I told you 12? 12, right? Yeah. He was working at St. Joseph when I had the honor of being the director of volunteer services over there. Beautiful chapter of my life to get to know the health system and such a love for what St. Joseph is doing in our community. But Michael, tell me a little bit more about yourself because I'm not sure that even was a position when I was around 12 years ago.
Well, no, it wasn't. We are developing a program that's associated with the Affordable Care Act. We manage the ACO, which is the Affordable Care Organization, and takes care of around 5,800 Medicare lives in our community. But as an adjunct to that, we started looking at the folks that were unfunded that use our facilities and don't really have any place else to go.
Right.
And so we started paying attention to them and trying to decide what we could do for them. So my position has really expanded a lot past just caring for our Medicare population.
So when was your position created, though? About when?
In September of last year.
Oh, see, it is repaired. Okay, I'm not so behind the times.
Actually, the entire program came into existence about 2.5 years ago.
Okay.
David Overton, who is my boss and our vice president over care coordination, started the program, developed it, and then we've slowly built it up to where it is today.
That's wonderful. So do you work there at the main campus of the hospital?
Actually, across the street. we're far enough away. It's sort of like the in-laws that they're far enough away that they leave us alone, but close enough we can get there if we need to.
Oh, excellent. And Reed, so good to see you. You've been working in the rural areas of the Brazos Valley for more than 12 years, because that's how long ago it was when.
Yeah, I've been out there for 16 years.
16, okay.
And I started in Madisonville. About a month later, I went to Burleson. Worked about 12 years at Burleson St. Joseph Health Center. Have now the last 4 years I've been at Grimes St. Joseph in Madison St. Joseph.
Well, let's tell our listeners a little bit more about what you actually do. You are a rural administrator?
I am. I'm the original administrator in charge of two facilities. Both are critical access hospitals, and actually so was Burleson. Critical access. When we started, we had we were really dealing with a lot of poverty in the rural areas, and we were trying to come up with methods and alternatives to be able to keep rural hospitals alive and afloat. And so we came up, we didn't come up with it, the state came up with a critical access hospital designation. It's a national program. And as a critical access, we were the 5th hospital in the state of Texas. There's now 80 in the state of Texas. We were the 5th in Burleson to come in and join that process. Now, a critical access hospital is a short-term stabilization crisis center, basically an ER with very short-term acute care. If you need long-term acute care, you're going to go to a bigger hospital.
Right. So it's like, I'm imagining that there's trauma that happens in these outer-lying areas. You come into a rural hospital like this, they stabilize you enough to be able to move you to a more lengthy stay, say, down into Bryan.
That's exactly right. Okay. And then the reverse of that, once you go to the other hospital, have your surgery and stuff, and you need to have rehabilitation, then the skilled care can come back to the critical access hospital. And so that's the back end of the other side of the inpatient presence, and it's services closer to home.
Right. So, folks, as you can imagine, Reed has really experienced the outerlying areas and, again, the poverty that is in the county. So what counties are we talking about here?
Well, the counties that I've worked in are Madison, Leon. I've worked a little bit in Washington County with the WIC program. I worked in Burleson County, Grimes County. We've done a little bit with Robertson County with the rural health clinics because we had 8 rural health clinics. So we pretty much touched the Brazos Valley at the outlying areas, the 6 counties that are associated with the Brazos Valley in the rural counties.
Right. So as you can see, folks, these folks really have their finger on the pulse of the communities and the widespreadness of the poverty that's there and what's available as far as Brazos Valley too. So we're going to get into some really cool stuff about what they're up to as well and ways that we can help. Mary Claire, back to you. So how do you fit into this picture?
Well, when I started here in Bryan, I came from Los Angeles, I really saw an opportunity there was a hometown feel here, very much community feel, but to really be a significant contribution to the poor in this area. How do we keep people well? How do we, and if we can't keep them well, how do we make sure they're cared for?
Right. Well, let me just tell everybody the origin of how this, the thought or the idea for the show came about. It's been a few months back now. I had the privilege of going to a Bridges Out of Poverty seminar that Mary Claire put on at St. Joseph Hospital. And I really, really learned a lot because I think I kind of live in a little bubble. I'm not as exposed to what's really going on. And I felt it just really touched my heart. And I thought people need to know this. And so I've asked her to come back and share a little bit from that experience I had because I thought it was so very enlightening about what's going on. The most heartbreaking parts of it were how there's like a cycle that it's really hard to break out of. That if you make too much money, then you get kicked out of certain programs and things like this. So let me just go ahead and back up a little bit. And if you would just give me kind of start with some of the statistics of the Brazos Valley in general and what you've been exposed to.
Well, the Bridges Out of Poverty is a program that I was trained by Ruby Payne. She's the one who originated it. And to bring to the Brazos Valley to start to teach the thinking behaviors of the different economic classes, and that there's a real difference and approach. We can't approach everyone the same way. Poverty in the Brazos County is is about 36.4%. If you take out the college students, it's about 30%. And what's unique about Bryan College Station in particular is that there's such a disparity. You have a large percentage, 44% in College Station, that are the high level earners. And then you have a number of families in the lowest income, under $25,000 earnings a year. And the percentage of the lower level of income is actually higher here than in the state of Texas.
What?
So there's like no middle. It's the very, very poor. And then you have the higher incomes. And basically that's because of the university that is here.
Oh, wow. Okay.
So it really is something that needs to be addressed, that is unique to Brazos Valley, and that St. Joseph has really put a lot of time and attention into building programs to address these. In fact, Reed has some wonderful stories of how he started, was part of the creation of the health resource centers that we have in the different outskirts of counties.
Okay. Reed, do you want to tell us about those?
Sure. The Health Resource Center started basically in 2002, and it really began with the assessment process of the Brazos Valley. And an awful big part of poverty is the lack of health care, the lack of the ability to pay for health care, and those types of things. So we really wanted to look at all of our health issues throughout the Brazos Valley. And we wanted to do it in a really efficient way, but also a really important way to make sure that we're addressing the issues by county as to what really is going on, so that we attack it. We use Texas A&M and Dr. Burdine. He wasn't with Texas A&M at the time, but he is now. But anyways, he was the original person who did the assessment process. We assessed over 4,000 people throughout the Brazos Valley, and from assessing the people, then we came up to a conclusion that about 10% of the resources were getting out to the rural areas from the deal, and about 42% of the population lives in the rural areas of the Brazos Valley. So we knew we had a 32% disconnect. And in that process, then we knew we had to do something to try to make it so that services could be available. We found out the number one problem in the rural areas was transportation. People couldn't get to the services that were available for them in Bryan College Station. It sounds unreasonable that somebody couldn't make 45 miles, but they couldn't. They couldn't get to the services that were available.
Yeah, if you don't have a car, it's not like you can walk it, right?
Yeah,
I mean,
and Brazos Transit requires a small fee when they were coming out to the particular area, and they didn't have $5 even to be able to travel for that particular distance. So it was a real problem. And what we tried to do was to come up with a process to bring services back out to the rural areas, and also to build a transportation services for those that are inefficient coming out to the rurals, to bring them then into it. We got a big grant through HRSA, and several of us worked on this particular situation. And we now have resource centers in Leon County, Madison County, Burleson County. There's one in the Mission in Washington.
I have a question then. So if it's a resource center, say what would a person in that situation, I don't have a car, I need to make a doctor's appointment, say even it's just, a young woman, prenatal care, how does a resource center help them?
Well, one of the things we noticed in the emergency room is a patient comes into the emergency room and they have a medical problem. The doctor takes care of the medical problem, and then that's the end of the story. 2 weeks later, he comes back into the emergency room. He has a medical problem, and the doctor takes care of the medical problem, and he goes. 2 weeks later, he comes back again. And so we're seeing that constant back and forth in our emergency rooms. And what we realize is we're not doing a very good job of assessing the situation. We need to look at the whole picture. And so we do about a 2-hour assessment of people when they come into the resource center to find out all their needs. And from there, then, we could probably talk about the rest of the story later if you need to.
Yeah, he's looking at me and saying, we need to take a break. We're going to take a short break here. But in just a few minutes, we'll be back with the folks from St. Joseph Regional Health Center discussing poverty in the Brazos Valley. Welcome back. This is Pam Marvin, your host of Red Sea Roundup for today, and joining me are a wonderful group of folks from St. Joseph Regional Health Center. We're talking about poverty in the Brazos Valley. We're going to go ahead and continue our conversation with Reed, who is a rural administrator in this area. And you were just talking about a program that's how new is that program you were just talking about?
Well, we've been doing this program since 2002. So
it's not new.
Years,
Okay. So tell me how it's kind of evolved and how people can take advantage of this program. Maybe they are in the rural areas now and they're not even aware of how this can help them.
Well, let me just give you a few facts because I think it's important for people to know and understand what poverty in the rural areas and why it exists. We have less access to services. We have less support for disabilities. We have less quality education opportunities. We have less programs that are developed for transition from welfare to work. And it's problematic because the rural areas, it's inefficient and inexpensive, and it's very expensive to carry out those educational processes. Our rural rate of poverty, though, is about 5% higher, and that's gone on now for the last 40 years.
When you say 5% higher than
the urban areas,
but then again, as Mary Claire was saying earlier, it's even worse here in the Brazos Valley?
Well, the Brazos Valley has two types of poverty that they're dealing with. They have generational poverty from family to family, and that's the toughest kind of poverty, and there certainly is a lot of that in Bryan College Station area too. They have situational poverty where kids are going to school, they're not working, or they don't make enough money to reach the poverty level. And so those are a little bit different in the Bryan College Station. And like Mary Claire said, you have your up and your lower. The middle class is very rare in the Bryan College Station area.
Right. How they define the difference between situational and generational poverty is, especially in our economy today, you have more situational poverty due to divorce, death, illness,
loss of jobs,
and things like that. That's considered situational poverty.
Mm-hmm.
The generational poverty is considered for those who live in poverty for 2 generations or more, and really becomes a cycle, and it changes your way of thinking, changes your way that you have choice, that you really have the same opportunities. It's a domino effect. When something does go wrong, you don't have the resources to get yourself out of the situation, and it tumbles to other situations.
So looking at the rural areas and realizing that most of our resources were available to us were in Bryan College Station area, we had to try to figure out an efficient way to do it. And part of the group came together very early on and said, sustainability is something that we think is very important.
What do you mean by sustainability?
Well, what it means is that if we're going to set something up, let's just not do a grant. And then when the grant runs out, the program ends.
Right. Okay.
Let's do something that has the ability
a lasting effect.
A lasting effect.
Okay.
And that we've got people that are committed to the process. That if you say you're going to be in the program and you want to help in this particular area, then you have to stay in the process.
You're in it to
long-term.
win it, right? Yeah.
That's exactly right.
Okay, I got
exactly
it.
Right, and that's and that's been a commitment. And today we have 13 years of providing it because the people that have been in the process have been very committed and have stayed to it.
Yeah.
We looked at all the different types of services. It's really important that you work with children. You have to catch poverty early because if you don't, by the time they get to teenagers, the peers take over, and the peers make the determination as to where they goes because the parents have really lost control of the children at that particular time, and they relate to their peers as far as how they're going to solve their problems and make their determinations. So catching young children is a very important part of what we do in the Health Resource Center, and we have many programs that are associated with children under 5 years of age.
I was going to say, what does it mean to catch a child like that?
A STAR program with MHMR, for example, is very involved in.
What is a STAR program?
It's a program that helps children.
Like Head Start?
It's like a Head Start, kind of.
Okay.
But it's different types of programs where they assess the needs of the particular child, and then they bring those services to the child through the MHMR program.
Okay. It used to be called,
I think that's important. I think on the other end, because elderly also are staunch into the poverty situation, and so it's very important that our elderly people have programs and services that meet their needs. Food programs, for example, Many times we have a program through the Council of Governments, a senior meals program that we offer about 60 meals per county to each of the areas. That's delivered 5 days a week.
And that's
in some cases, that's the meal they get a day. But it's not only the meal they get, it's the socialization that they get. Sometimes that's the only person that they see that day is the person that brings them a meal.
Let me ask you about the Council of Governments then. Is this I've seen it around. I don't know that much about it. It is a 501(c)(3)? Is it staffed by volunteers or volunteers and staff?
Well, it's a government program, so it's all your county governments, and it's it's a very, very well run program, and it's out of Bryan College Station, but it serves all the counties, all 7 counties of the Brazos Valley, and they have many programs.
They have many. Would you say that that's one of the largest one though? The Meals for the Elderly.
Well, that's a big one for the senior program, certainly. But there's a lot of programs that they do through the Council of Governments. They're really working hard in technology. They're working hard on getting people into jobs, workforce analysis. Mm-hmm. I mean, the Council of Governments has a huge responsibility. And the one thing we've found with the Health Resource Centers that is very important is partnering, getting together with other people and sharing the resources. It used to be that St. Joseph could be very, very viable in the rural areas and any area of the Brazos Valley. Only about 5% of the people didn't have insurance and couldn't pay their bills, and most of the people had 80-20 plans, and life was pretty good, and it wasn't that difficult to take care of. Today, we have about 27% of the people in the rural areas that don't have insurance and don't have any coverage, and we can't do it by ourselves. It's too much of a burden for any one hospital system to take on those particular areas. So partnering up with other organizations is what the Health Resource Center is all about. It's sharing our resources. St. Joe's puts in its part of the buildings and the facilities and the utilities, mm-hmm. and then the other people come out and bring their services, and we have grants that have gotten us vans and stuff like that that's helped us too.
Hey, Rita, I want to go to not necessarily switch gears a little bit, but I know that these programs have really affected lives in the Brazos Valley, so I'm sure you probably have some really good stories about the way it's helped. So I'd like for you to take a second and tell us about one of those stories that's really close to your heart.
Well, there's a lot of stories that are close to my heart, but there's always a story about the client that comes to the resource center, doesn't have, lives in a car, very, very, actually having quite a bit of mental health problems. We have telehealth counseling. The person went on for quite a period of time, still living in a car, getting food delivered to her car. For a senior meals program, and so a lot of the services, what we started to see, and what we also have said in our resource center, how important it is to get people back on their feet, to use the Project Unity helps us with utilities, and the other organizations have their part of the pie. We literally did get this lady out of the car into a home, and it's a very exciting thing to see somebody's life start to turn around and to realize that what you're doing does make a difference. We're not about just taking care of people in poverty and keeping them there. We want to lift them up, and that we're trying to use the ministry in a positive way to lift people and get them back on their feet. That's what the Health Resource Centers are all about, and we're proud of it. It's doing a good job of meeting a lot of needs. That's
really wonderful. Well, before we move on to Michael, because I'm really fascinated about, now we're in the outlying areas. Rita, is there something more that you maybe said, I've been wanting to make sure I mention this before we move on to Michael to talk a little bit about, more the center of cities?
No, that's fine. Michael has an exciting story to tell you.
Yeah. Well, thank you for all your work. I just want to say a personal thank you from our community because you've had a love for this. You've really stuck with it as well. You've been very dedicated. And I just want to personally thank you on behalf of our community, Reed. Seriously. Okay. Michael, so again, you have been in this position since September, or it's more of a new, right?
Well, the program itself is new, only 2.5 years old. And then I came here from Beaumont to take this position to manage our ACO program.
Okay. So let's bring it up to date. What exactly are we doing now? Say someone comes into our area, and folks, let me just go ahead and put the reminder on this that the hospital area really has their finger on the pulse of a lot of the poverty in our area, because one of the more beautiful things, even though it involves a lot of suffering, all walks of life, race, ethnicity, all comes together because of the human condition under the umbrella of St. Joseph, or the hospital situations in general. And so they get to see all parts of humanity in our area that are coming and they are in need. And so that's why the reason I think that they have such a good idea about what's going on. They meet these people, they're looking them in the eyes, and they know what's there. And so today, Mike's going to tell us a little bit more about what the hospital system is doing in the Brazos Valley to try and keep people healthy and maybe lift them out of poverty and keep them out of there as well. So go ahead and tell me. Hit me.
Okay, I think one of the things that we started with was looking at the fact that we were spending a lot of money taking care of people, but we weren't really taking care of them. We were treating them in the hospital, in the emergency room, and hospitalization, but they kept coming back. So we weren't getting to the root of the problem, and the decision was made that we needed to look at it and decide, well, where is the money best spent so that the person is best taken care of? And we realized that just like everyone else in the world, having a primary care physician, having community services could treat your problems and keep you out of the emergency room, keep you out of the hospital. I think a lot of people go to the emergency room and they think, well, that's I'm going to get taken care of. I'm going to get cured. But they don't realize the emergency room's not there for what we call definitive care. It's there for the moment. And for the moment, it may take care of that problem. But for the long run, it doesn't take care of the problem.
So when you say definitive care, I'm imagining that it's more of looking at the whole picture of a person, everything from life situation to maybe long-term illness or ailments. I think I was getting those two words mixed up. Say like a diabetes situation or something like that. Is that what you mean by definitive care?
Right. You can go to the emergency room, get that emergency care, but when you're at home, you may need a phone. You may not have your medications, so without the medications, you're going to go back to the emergency room. You may not have transportation. You may need food. You may need clothing. There's a lot of other needs that are not medical, social needs, that go into making sure that the person is taken care of.
Okay, let me stop you for just a second, because when I went through the class with Mary Claire, one of the greatest issues that kept coming up over and over again was the transportation. Even if a person could afford their medications, perhaps they couldn't even get to the pharmacy in order to get their medications. And I know this has been a long time issue in the Brazos Valley since I was even at the hospital all those years ago. Are there programs that have come up that have helping a little bit to, or not quite yet? The first thing that comes to mind is I think I've heard say some type of grants that go to taxi services to help these folks get to their appointments or get their medication. Are there things like that?
We have services, and they're fairly inexpensive, but inexpensive for me is not really inexpensive when you don't have money at all.
All right.
I was thinking about Reed's story with the person living in the car. You think, well, sell the car and get taken care of. But that car is something that the majority of our patients don't have. And that car can get the person to the right place to get the care they need. And transportation is very difficult. We have taxi services, and actually St. Joseph's is now paying for the taxi services that these people need. We do have a bus service, but you've got to make a reservation, and then that seat's yours.
Now, is this through Brazos Valley Transit, or does the hospital have its own bus now?
No, through Brazos Valley Transit.
Okay.
And so you make a reservation, and you've got to be there and on time, and it may take you somewhere 2 hours too early, but it's going to get you there. But the convenience, what you and I would do for, I'm going to run see the doctor, I'll be right back, may take these people that we're taking care of an entire day to get.
Right. And it could mean a loss of wage if they actually have a job.
Exactly.
Which is devastating.
Exactly.
In many cases.
Another thing that Mary Claire has thought about is gas cards. We have a person that we actually are purchasing the gasoline for them so they can get where they need to go. We provide everyone with a phone. And it's our phone. We tell them from the very beginning, that's our phone. Don't just blow it all away. We give them minutes on the phone so that we can get in touch with them, so that we can stay alerted to their issues and their problems. And if they need help, they can call us. Little things like that aren't medical, that you don't realize. It's absolutely amazing when we look at the amount of money that the hospital had spent on emergency care and hospitalization. And when we have taken care of these people, we've cut that amount of money down to a minimal amount. It's amazing the difference. And this isn't about money, but what I'm saying is the care that these people need is not that expensive. And they need it right there in local, at home where they are living, and not back in the emergency room or back in the hospital. Quite frankly, no one wants to be in a hospital. It's not a fun place to be. It's not always a healthy place to be. And so, and we feel that taking care of them in the community, making sure they have the care they need there, is really important.
Well, I wanted to ask Mary Claire a little bit more too about because in the Bridges Out of Poverty, I think there were a few key elements, things that we can do to help people kind of break the cycles. Am I remembering incorrectly?
No, you're remembering correctly.
Okay. I might be putting you on the spot, so forgive me if I am. But I was just so taken by it because, someone like if you think about our listeners right now who usually have a big old Catholic heart and really want to do something what's going on. I don't know if it's volunteerism, but just really realizing that giving a friend a ride to get their medication or to a doctor's appointment is such a vital thing. So tell us a little bit more about what we might be able to do.
My hope with this program today is that we build awareness of the need that is out there in the Brazos Valley and understanding poverty in terms of how we do things. Many of these people go from agency to agency for help. Like St. Joseph has partnered with St. Vincent de Paul to help us with some of these social issues and barriers that people are experiencing that are unfunded as they try to seek their medical care. And as Reed was talking about, looking at the whole picture. But, they don't, every time they go to one agency or another, they're given applications, paperwork. And that's a very abstract idea. They're very concrete. And we need to be more concrete with them. We need to help them plan. If you're living in chaos or you're living with unpredictable circumstances and in the survival mode from one day to the next, your ability to plan, it really is taken away. And so if we can build systems and processes that can help them plan, how do I get to this point, this spot? I'll take an easy example. How do I make sure my child goes to school on time? And so you walk them backwards, really, on what all the things that need to be done. So if I get up at this time and eat breakfast at this time, and Johnny gets dressed at this time, he can make sure he gets the bus on time and is at school. But that kind of planning is not natural. It's not typical for those that are in poverty situations.
So it's like pretty much a cycle that they've gotten caught up in. Maybe they've never been taught themselves, so they don't know. And what kind of program are there? Programs that go in and help?
There are programs that help train for Bridges Out of Poverty. It's called Bridges Out of Poverty Training, and I have given the presentation to lots of our community members to try to assist in the understanding of how do we need to approach poverty and give this understanding. It's just like if you were in a trauma situation, if you're in a fire, you're not thinking about, okay, did we prepare all the preparations? You're just trying to get everybody out. And that's how their lives are. They're just trying to get to the next day. My kids are fed, and that I can pay the rent, or the landlord's not going to knock on my door tonight to ask me for the rent. But those are, and it's constant, and it's constant pressure. And so to have an appreciation of what it's like to live like that on a day-to-day basis and what you do without. So healthcare, for instance, they have this idea that I've lived without this medication for this long. I can live some more without it. Or my granddaddy never took medication, and he lived till he was 95. So why do I need to take it? And so it's those ideas about health, about what I need, how do I take care of my body, the responsibility and the accountability for it. A lot of it has to do with planning.
Michael?
Yeah, let me say something about the medication issue. It's easy to say, well, why don't you get a job and be able to take care of yourself? But we have some very good examples where medication is the barrier. All of us know about emphysema and COPD and breathing problems, asthma. And you think, well, gee whiz, if you've got asthma, if you've got breathing problems, get the medication, take care of them. Well, guess what? The breathers cost over $200 for 1 month's supply. Now, that's an amazing amount of money, particularly when you don't have any. So if you can't breathe well, you can't get a job. And you can't get a job, you can't pay for the medication. It's a cycle that starts very innocently. And you think, well, okay, I'll do without my medication, and I'll try to get that job. Or I'll try to get me some food, or I'll get some clothes. But then without that medication, you find out you can't do those things. So what we try to do is make sure that the support system that people need to be able to take care of themselves is supplied, that we give them the things they need, the basic needs to take care of themselves, to help them boost themselves on up out of poverty and take care of themselves.
You know, one of the things that Mary Claire has talked about that I think is brilliant is basically the faith community having a hand in caring for these folks, because I think of my faith community in general, and we kind of know when people are ill or not and need our loving care and support, but it's not to the level I would think that we have a homebound and sick care, because right now it's limited. So I want to see that kind of thing really expand, because I know like our listeners will be like, yes, that's exactly the kind of thing I'm talking about. I can go sign up with my local parish, my faith community, and be able to help these folks, give them a ride. I don't know, other things like that. So Mary Claire, can you talk about this program?
I had started the Faith Advisory Network with the idea that we could collaborate among the different faith denominations. All these churches are here in the Brazos Valley, and we really are a faith-filled community. I mean, this is a special. It really is a special place.
It is.
And to get everyone, instead of working, the ministries that each church does is duplicated in the different denominations. So instead of working in silos, we could collaborate with one another. And my hope and my vision is that a particular church would feel called and say, hey, we want this ministry. We know transportation's a true need here. We want to be the transportation ministry here. And, so somebody else takes on clothing or food or visitation. Loneliness and isolation, especially in the rural areas, is really an important need. The people need contact, whether even if it's just a phone call to check in on them. And so to build this kind of network among each other and to be aware of who's in need. So this Faith Advisory Network meets once a quarter. And I have brought in our charities, providers are there, so that they can talk about not only the person who's going to the church in need, but who's also going to our charities. And we can say, how can we help one another? So that was the whole vision of that.
I like that. Now, do you have a certain number of churches that have signed on to this? Like they sign up, they're part of it, or is it formed to that point yet?
I have invited all the churches that are in this area, and so they participate on a quarterly basis, but there's not a sign up per se.
Gotcha.
But we have lots of churches interested in seeing this movement continue.
Excellent. Yes, I'm very interested in seeing that continue. I think it's a great notion because as Christians and people of faith, we really need to help our brothers and sisters. So I want us to see something like this grow a little bit more. So let's, with our listeners, and you have a list here of some of the different areas, the different organizations in our area that have been very effective in helping the poor of our community. I'd like to take a second and start to talk about those. So say I'm listening to the program today and have really had a heart for the poor of our community. Where's a good place to start?
St. Vincent de Paul has really been a godsend for us in partnering with them. We will go with them on a home visit to actually see one of our patient families, and so that we can assess the whole situation. And they have connections into some of the barriers to care or being healthy, which is food and clothing. And perhaps we visited one family that didn't have any air conditioning. Their electricity was off. And you can't feel well with having a heart condition and no air conditioning in this heat. And so they, were helping put the electricity back on. They also help, which was to my surprise, when you're in poverty, some of them have these predatory loans. And one of these ladies was paying $300 a month, and it was just interest on a $1,000 loan.
Holy mackerel.
And it has been paying for a couple of years now. And so St. Vincent de Paul said, we want you to be able to afford your food. So we will take that loan and so that we'll pay it off for you and give you a low interest rate so that she can come out and be, out of that poverty, out of being, stricken without being able to afford anything else because of this loan that keeps her under.
Right.
And that's part of the great thing. And once you get to know the lives of these people and see the whole situation, you're really able to assess, well, how best can I help them? Because, for instance, this person, to give them food wouldn't have been best. They needed food temporarily, but really what's blocking them from being able to provide for themselves was this predatory loan.
Mm-hmm. So it is, again, just as I think is so wise to be able to sit and look someone in the eye to understand, the heart of their issues, which is really what we're all talking about here today, is not only the symptom or let's see the result of, but let's know that person. Let's get to their heart. Let's get to the heart of the matter and change that to change the results of what's coming out of it.
But also I want to mention the Brazos Interfaith Immigration Network has been very helpful with our immigrant population and helping them. They have legal services that they offer that come down from Austin once a month. Catholic Charities is also another group that has helped mothers and with utilities and things like that. So we have a number of charitable organizations in our community that are great partners with St. Joseph's.
That's wonderful. Those are, yes, I'm a big fan of St. Vincent de Paul. I know a lot of those folks and have for years, and believe it's a really great program. But based on what I've kind of learned today, I think St. Vincent de Paul has a lot of the situational, in a way. They deal with a lot of situational. Is that not true? Do they have programs also that help to educate people how to lift themselves out of long-term generational poverty?
Pam, I think, too, one of the things I think is really important is healthcare is in an evolution right now, and it is trying to become population-centric, which means we don't just have a responsibility to take care of you when you're sick. We have a responsibility to keep you well. And keeping you well is such an important component to poverty and this whole aspect. So the best minds in the world are starting to really look at this in the right way, as far as I'm concerned. And every day we get new ideas, new ways of coming about how we're going to do things. We've got to come to efficient and have the ability to sustain the processes that we do set up. They need to be things that you can look at, and for people to fund things and to get into that, we need to make sure that we're doing the best that we can in sustaining them.
And let me say about our ACO program, Mary Claire and I were talking before we started this up. It's not a poverty or a charity program, but when you look at the 65 and older generation, many of those people are living at the edge. And my nurses call them up, talk to them, try to help them find out, what do you need? What kind of support would help you get the things you need so that you can live a comfortable life at your age? And that's a challenge. It's sometimes more of a challenge with people that have a little bit of income and they've got a home, but then maybe they can't leave that home. Maybe they are stuck there because of medical reasons. And so we are trying to make sure that they have the services they need so that they can stay in their home. They're not taken out of it. They're not having to go live somewhere else. They have what they need to be able to sustain life in a quality life in a comfortable setting. So even though it's not taking care of poverty-stricken people, our entire program looks at taking care of the entire range of ages and their needs.
Now, right now, it sounds like this program, and tell me what the acronym stands for again. The
Affordable Care Organization.
Okay. So it sounds like this program is mostly made up of staff and not necessarily volunteers that would go to help in the community. But I'm sure there's a great need for volunteers as well in the hospital setting to go out and care for folks. Can you tell me we're winding down, so if we've got about a minute left, and if you want to tell me some of those things, make sure I get this in, or how people can help.
I think this is Mary Claire, and I think that we would welcome volunteers, and I think that's something that needs to be developed further in terms of the underfunded program that we've started, is how do we engage the community and volunteers into helping us do the home visits, caring for the people in the community.
Yeah, I really see that as integrated into your faith advisory board
too.
For the faith community as well, Mary Claire. And I would really pray for success of that, because I think you're really onto something there. And let me know how I can be of service. I would really like that. Well, today has been really wonderful. I want to say thank you to each one of you for what you do in the Brazos Valley and educating our listeners a little bit more. Some of the organizations they've talked about today that are really doing a great job is St. Vincent de Paul and Catholic Charities. There's one other one on here. A&M
Brazos Interfaith Immigration Network.
Brazos Interfaith Immigration Network. So these are all some really wonderful organizations. If you're listening and you want to take part in it, or if you are you hear about the Faith Advisory Board that we may need to sign up with that, just give us a call here at the station, or me personally if you know me, or the hospital at Mary Claire. Again, I really want to say thank you to each one of you, to Reed and Michael and Mary Claire. It's been a pleasure and an honor to be with you, and thank you again for what you do. I want to say thanks to everyone again for listening to Red Sea Rodeo. Listen to me, Red Sea Radio. But next week, Judy will be back in the hot seat. And until then, when choosing between the values of heaven and the world, always round up.